By the time you turn 65, there is a distinct possibility that your bladder is essentially running your life. You are planning your road trips around rest stops. You are memorizing the layout of every restaurant you visit just to know where the restrooms are, and you are getting out of bed 3 or 4 times a night just to squeeze out a few frustrating drops. Your doctor probably told you this is just a normal part of getting older, or maybe they handed you a prescription card for a pill that dries out your mouth and makes you feel dizzy. But what if the real culprit isn't just an aging body, but a profound, unrecognized starvation happening right inside your bladder wall? There is one specific, overlooked vitamin that acts like structural concrete for your urinary system, yet it is almost never checked on your annual physical, and millions of seniors are completely running on empty without ever knowing it. I am Dr. Carl. I have spent the last 16 years practicing as a urologist, treating thousands of active seniors who just want their freedom back. Today, we are going to break down the exact 7-step blueprint to rebuild your bladder from the inside out, including the specific foods that act like sandpaper on your urinary tract, the nighttime habit that is accidentally tricking your kidneys, and the precise dose of the one natural vitamin that can finally help you sleep through the night. Make sure you pay close attention to number 5 because it is a completely free physical movement you can do while watching television that actually re-anchors your bladder support muscles. Before we dive into the first step, I want to ask you a quick question, and I want you to be completely honest with me down in the comments section below. How many times are you currently getting out of bed each night to use the restroom? I read every single comment personally, and your answers directly shape the medical guides and topics I cover in these videos next. Let's start with the first major piece of this puzzle, which is understanding the silent thinning of the bladder lining. As we navigate life after 60, the tissue that lines the inside of your bladder starts to lose its natural thickness and elasticity. Think of a healthy, youthful bladder like a thick, robust balloon that can stretch and hold liquid without any trouble. As we get older, that balloon turns more like a thin, fragile paper bag. When urine sits against a thinned bladder wall, the natural acids in your waste irritate the nerve endings underneath, sending a panic signal to your brain that says you have to go right now, even if your bladder is barely a quarter full. Clinical observations and research reviews, including papers discussed in major urological forums, suggest that maintaining the structural integrity of this tissue barrier is the absolute key to stopping that sudden, desperate urgency. To start protecting this lining this week, I want you to focus on increasing your intake of healthy fats, specifically omega-3 fatty acids from sources like wild-caught salmon or a high-quality green-lipped mussel oil, which help support cellular membranes. Of course, if you are taking any blood thinners or managing complex cardiovascular issues, always run any new supplement changes past your primary care doctor first. Second, we have to look closely at what I call the morning acid bomb. Many of us love starting our day with a hot cup of coffee or a refreshing glass of grapefruit juice on the patio, especially during retirement when we finally have the time to slow down and enjoy the morning. But these highly acidic beverages act exactly like pouring rubbing alcohol on a sunburned bladder. They drastically lower the pH of your urine, making it incredibly caustic to an already sensitive system. The American Urological Association frequently highlights dietary modification as the first line of defense for bladder sensitivity, noting that acidic and caffeinated drinks are primary triggers for urinary frequency. Your action step for this week is simple but highly effective. Swap out your morning coffee for a low-acid alternative, or switch to a soothing herbal tea like chamomile or roasted chicory root for 7 days straight. You might be amazed at how quickly your bladder settles down when you stop aggravating it first thing in the morning. Third, let's talk about the nighttime fluid illusion. A lot of seniors tell me they stop drinking all liquids at 4 in the afternoon so they won't have to get up at night, but they still find themselves waking up at 2 in the morning to run to the bathroom. Here is the medical reality of what is happening in your body. When you completely dehydrate yourself in the afternoon, your urine becomes highly concentrated, dark, and filled with waste products. This highly concentrated liquid is incredibly irritating to your bladder muscle, causing it to spasm and wake you up out of a sound sleep. Furthermore, when you lie flat in bed, the fluid that accumulated in your legs during a day of golf or walking around the neighborhood naturally rushes back into your bloodstream, forcing your kidneys to produce a massive amount of urine right when you are trying to rest. Mayo Clinic reviews and general physiological studies show that fluid distribution changes significantly as we age. Instead of starving yourself of water, your action step is to drink consistently throughout the morning and early afternoon, taper off 2 hours before bed, and spend 30 minutes resting with your legs elevated on a few pillows in the late afternoon to let your body process that fluid while you are still awake. Fourth, we must address the hidden pressure from the colon. This is an uncomfortable topic for many, but as a doctor, I see it every single day in my clinic. Your bladder and your lower bowel sit right next to each other in a very tight space inside your pelvis. If you are experiencing even mild chronic constipation, which is incredibly common after 60 due to changes in digestion and certain medications, that full bowel physically presses against your bladder. This chronic crowding reduces the total amount of urine your bladder can physically hold and constantly stimulates the nerves that tell your brain it is time to empty. Gastroenterology and urology research has long linked bowel regularity with improved bladder control. To fix this week, I want you to add a daily serving of soluble fiber, like ground flaxseed mixed into oatmeal, and ensure you are moving your body every day. If you are taking regular prescription medications for blood pressure or pain that contribute to constipation, make sure you have a conversation with your doctor about safely managing your digestive health before changing your routine. Quick pause here. If this information is helping you connect the dots about your own health, please take a moment to tap that like button. It truly helps this video bypass the algorithms so it can reach more seniors who are quietly suffering with these issues. And let me know in the comments if your doctor has ever mentioned the connection between your bowels and your bladder before. Fifth, we have the re-anchoring technique, which is a specific way to rebuild your pelvic floor support structure. Think of your pelvic floor muscles like a hammock that holds your bladder, uterus, or prostate perfectly in place. Over decades of lifting grandkids, coughing, or just living life, that hammock naturally stretches out and sags. When the hammock sags, the neck of your bladder drops, creating a constant mechanical pull that mimics the sensation of needing to urinate. Studies published in the Journal of Urology consistently demonstrate that targeted pelvic floor muscle training is one of the most effective non-invasive ways to reduce both stress and urgency incontinence. Your action step this week is to practice proper pelvic floor contractions. The next time you are sitting in your favorite chair, imagine you are trying to stop the flow of urine midstream or stop yourself from passing gas. Lift those internal muscles up and inward. Hold for 3 seconds and release for 3 seconds. Do this 10 times in the morning and 10 times at night, ensuring you don't squeeze your stomach or hold your breath. Sixth, we need to talk about the artificial sweetener trap. Many financially comfortable retirees are highly health conscious, so they naturally reach for diet sodas, sugar-free yogurt, or packets of pink, yellow, and blue sweeteners to keep their blood sugar stable. However, these synthetic chemical sweeteners are notorious bladder irritants. When your kidneys filter them out, they create an unstable environment in your bladder that triggers rapid, involuntary muscle contractions. Urological research frequently identifies artificial sweeteners as top chemical culprits for overactive bladder symptoms. This week, make a firm commitment to read your food labels at the grocery store. Replace anything containing aspartame, sucralose, or saccharin with pure water infused with a slice of cucumber, or look for small amounts of natural stevia if you absolutely need a hint of sweetness. Seventh, let's reveal the centerpiece of our discussion, the specific vitamin that strengthens your bladder naturally, which is vitamin D3 combined with vitamin K2. Most people know vitamin D is essential for bone density, but what your doctor rarely explains during your Medicare wellness visit is that your bladder wall and your entire pelvic floor are absolutely covered in vitamin D receptors. Vitamin D is directly responsible for maintaining the muscle strength, tissue elasticity, and structural integrity of the detrusor muscle, which is the main muscle that controls your bladder. Furthermore, vitamin D helps the body produce natural antimicrobial peptides that keep the urinary tract healthy. When you are deficient, that bladder muscle becomes weak, flabby, and highly prone to unstable spasms. Multiple epidemiological studies and urological reviews have linked low serum vitamin D levels with an increased risk of urinary incontinence and overactive bladder symptoms in older adults. Your clear action step this week is to request a simple 25-hydroxy vitamin D blood test from your doctor's office at your next annual physical. Many forward-thinking physicians recommend maintaining levels between 50 and 80 nanograms per milliliter for optimal muscle function. If you choose to supplement, look for a high-quality, clinical-grade vitamin D3 drops or capsules paired with vitamin K2, which ensures the calcium is properly directed into your bones rather than your soft tissues. To see how this works in real life, let me tell you about a patient of mine named Robert. Robert is a 72-year-old retired corporate executive who recently moved to a beautiful golf community in Scottsdale, Arizona. When he first walked into my clinic, he was incredibly discouraged. He loved playing 18 holes with his friends, but he was constantly panicking on the back nine because he couldn't make it between the restroom stations. He was waking up 4 times every single night, leaving him completely exhausted during the day. His local doctor had put him on a common bladder drug, but it gave him such a dry mouth he could barely swallow, and it made him feel slightly confused, so he wanted to find a better way. We checked his blood work and found his vitamin D levels were shockingly low, sitting at just 22 nanograms per milliliter. We immediately started him on a daily regimen of vitamin D3 with K2, had him replace his morning dark roast coffee with a low-acid alternative, and taught him how to do proper pelvic floor lifts while watching the evening news. Within just 4 weeks, Robert noticed a dramatic shift. He was only waking up once a night to use the restroom, his daytime urgency vanished, and he recently completed a full 18 holes of golf without a single moment of panic. He got his confidence, his sleep, and his active retirement back. To help you get the exact same results, let's review tonight's concrete action plan that you can start right now. First, swap your standard morning coffee or fruit juice for a low-acid herbal tea tomorrow morning. Second, elevate your legs on a few pillows for 30 minutes late this afternoon to clear out fluid before bedtime. Third, add a tablespoon of ground flaxseed to your breakfast to ensure your bowels are moving regularly and not pressing on your bladder. Fourth, perform 10 pelvic floor lifts in the morning and 10 at night to strengthen that supportive hammock structure. Fifth, call your doctor's office this week and request a standard vitamin D blood test to see exactly where your baseline sits. While strengthening your bladder wall is absolutely critical, there is another hidden medical danger that happens right inside the bathroom, specifically a strange, subtle change in the color and consistency of your urine that many seniors completely ignore, assuming it is just a sign of minor dehydration, when it is actually the very first warning sign of an underlying kidney issue or a silent bladder growth. I am Dr. Carl. Stay well, and I will see you right over there in that next video.